Revolution in lung cancer treatment, new therapies and genetics. Non-small cell lung cancer is having a growing impact on global health, representing a leading cause of cancer death. Its prevalence and consequences are a growing concern among physicians and researchers. Global statistics reveal alarming numbers, with a steady increase in diagnosed cases each year. This trend is particularly worrying in developing countries, where access to timely diagnosis and treatment is often limited. The main risk factors include smoking, exposure to pollutants, and a genetic predisposition. These factors significantly increase the risk of developing the disease, making awareness and prevention crucial. Therapeutic innovations are revolutionizing the treatment of non-small cell lung cancer, with new drug discoveries offering longer survival prospects. These advances are changing the landscape of options available to patients. Immunotherapy offers promising hope, offering patients new tools to fight the disease. This form of treatment stimulates the immune system to recognize and attack tumor cells, opening up new avenues in the fight against cancer. Targeted therapies have revolutionized the treatment of non-small cell lung cancer, tailoring treatments to each patient's specific characteristics. This personalization improves treatment efficacy, reduces side effects, and increases the chances of success. Genetics plays a crucial role in understanding lung cancer. Genetic interactions can influence disease progression and treatment response, making genetic analysis essential to developing more effective and personalized treatment approaches for each patient. Identifying biomarkers is crucial for early and accurate diagnosis of lung cancer. These tools allow doctors to detect signs of the disease earlier, improving the chances of timely treatment and more favorable patient outcomes. Advanced genetic testing is an innovative tool that analyzes a patient's genetic profile. These tests help predict the risk of developing cancer, guiding preventive strategies and enabling more targeted and individualized treatment. Genetic studies continue to unravel the complex link between genetics and lung cancer. Understanding how specific genetic alterations influence the development of the disease helps create more effective therapies and identify new opportunities for preventive and therapeutic interventions. There are several genetic screening approaches available to determine the risk of developing lung cancer, particularly for individuals with a family history of lung cancer or other known hereditary syndromes. However, genetic screening is not currently routinely performed for all patients, but it may be recommended in some cases. Some of the main tests include mutations in DNA repair genes, BRCA1/BRCA2. Although known to be associated with breast and ovarian cancer, some research suggests that BRCA1 and BRCA2 mutations may be associated with a higher risk of developing lung cancer, especially in non-smokers. Studies have suggested that people with a BRCA1 gene mutation may have a higher risk of developing lung cancer, especially in women. Rare inherited syndromes. Some inherited syndromes, for example, Li-Fraumeni syndrome or Lynch syndrome, which increase the risk of various types of cancer, may also involve an increased risk of developing lung cancer. These syndromes are caused by mutations in specific tumor suppressor genes or DNA repair genes. The treatment of non-small cell lung cancer has seen significant developments in recent years, thanks to new drugs that have revolutionized available therapeutic options, particularly with the introduction of targeted drugs and immunotherapies. New drugs include tyrosine kinase inhibitors, TKIs, for specific mutations such as osimertinib, Tagrisso. This is an EGFR, epidermal growth factor receptor, inhibitor used to treat NSCLC with mutations in the EGFR gene, one of the most common genetic alterations in this type of cancer. It is particularly useful in patients with T790M mutations who develop resistance to other EGFR inhibitors. Osimertinib, Tagrisso. This is an EGFR, epidermal growth factor receptor, inhibitor used to treat tumors with mutations in the EGFR gene, one of the most common genetic alterations in this type of cancer. It is particularly useful in patients with T790M mutations who develop resistance to other EGFR inhibitors. Alectinib, brigatinib, and lorlatinib. These are ALK, anaplastic lymphoma kinase, inhibitors used to treat tumors with an ALK gene fusion. These drugs have been shown to be effective in patients with ALK-positive NSCLC. Entrectinib, another targeted drug for patients with TRK and TRK gene fusion mutations, which is a new frontier for treating tumors with alterations that are rarely present but potentially treatable with this class of drugs. In more recent years, a new and promising therapy has been developed, immunotherapy, which has become a fundamental pillar in the treatment of non-small cell lung cancer, especially in advanced cases. Some of the best-known drugs in this class include immune checkpoint inhibitors, drugs such as pembrolizumab, Keytruda, nivolumab, Opdivo, and atezolizumab, Tecentriq, which work by blocking the PD-1 or PD-Cal1 protein, allowing the immune system to attack tumor cells. These drugs are particularly effective in patients with high levels of PD-Cal1. Combination immunotherapy, combining an immune checkpoint inhibitor with chemotherapy or other immunologic agents has shown promising results, improving responses in patients with advanced or metastatic NSCLC. For example, the combination of pembrolizumab and chemotherapy has been approved for patients with advanced non-squamous NSCLC. CAR T-cell therapies. Although still in the research phase, chimeric antigen receptor (CAR) T-cell therapies are emerging as a possible new option for lung cancer, although more work is needed to evaluate their specific efficacy. PARP inhibition therapies, in some cases of NSCLC, especially those with BRCA mutations or alterations in the DNA repair system, PRP, poly-ADP ribose polymerase, inhibitors are being studied to improve the efficacy of treatment. Other approaches include the use of monoclonal antibodies that block tumor growth signals or stimulate an immune response directed against the tumor. New molecules and combination approaches include gene therapy and nanomedicine. Research is exploring new methods to deliver drugs directly to tumor cells, reducing side effects and improving therapeutic efficacy. Non-small cell lung cancer research is making great strides, with new therapies in development and an ever deeper understanding of genetics. The future prospects are promising, aiming for more effective and personalized treatments for patients. Gene therapy and nanomedicine. Research is exploring new methods to deliver drugs directly to tumor cells, reducing side effects and improving therapeutic efficacy. It's crucial to spread knowledge and actively support research, because only through collective effort can we hope to defeat this disease. Share this information and promote medical progress to improve the lives of millions of people. If you're interested in this topic, subscribe to the channel for new videos on the topic.